So, as a sports medicine specialist, I have subspecialty training in the arthroscopic or minimally invasive treatment of hip pain in the athlete. And by far the most common pathology that we treat is something called a hip labral tear. And when I'm explaining this to patients, I do a lot of drawings here in the office. I draw on the paper here. And so, in order to help explain that, we've created an animation of that drawing along with an explanation.
The hip joint is a ball and socket joint where the femur bone meets up with the acetabulum or the socket. On the edge of that socket is a small bumper called the labrum, which has pain fibers in it and helps create a suction cup effect about the hip. Some people have slightly abnormal anatomy with a prominence of the femoral head-neck junction called a cam lesion or a cam bump. This can create abnormal forces when the hip flexes up that can bump into the labrum, which can create tearing and separation of the labrum away from the hip socket, which can cause pain. If that pain persists, we do have a minimally invasive surgical option to treat this pathology. We can go in with an arthroscope or in a camera and small instruments, and we trim back the edge of the socket. We can place an anchor in the bone, which allows us to sew that labrum back to the edge of the socket, stabilizing it and allowing the tear to heal. We can then trim down that cam bump so that there's relatively more normal anatomy, allowing the hip to flex up without bumping into the labrum, which protects the repair and keeps the labrum from tearing again.